New economic analysis from the Locke Foundation shows that Medicaid expansion is not free to North Carolina taxpayers, as Governor Roy Cooper and other activists claim. In fact, the idea is not only misguided public policy, says our next guest, but it's also a costly plan for North Carolina. Jordan Roberts is healthcare policy analyst for the Locke Foundation. He is the author of this new report we're going to be talking about now, and he joins us with the details. Jordan, welcome back to the show.
Thanks for having me.
Tell us about the economic analysis and this funding gap.
So what we found in our study is that Medicaid expansion in North Carolina would leave the state with anywhere between $119 and $171 million gap just alone in the first year. And that gap comes from the difference between what the governor believes he can raise from his taxes on health insurers and hospitals and the total amount of the state cost, the difference between those two. So we found that we believe the governor is underestimating total enrollment and the total cost of the program if we were to expand Medicaid in North Carolina.
What about after the first year? What would happen to the cost?
That $119 to $171 million is a funding gap just for the first year, and that gap would persist based on the total enrollment and the cost per enrollee, which we get into in the paper.
Jordan, your analysis is directly at odds with what Governor Roy Cooper has said repeatedly. He and the Health and Human Services Secretary, Dr. Mandy Cohen, at their COVID-19 news briefings over the past several months have mentioned Medicaid expansion. They are really pushing this as a public policy, not only related to COVID-19, but even if we had not gone through a pandemic. So where's the disconnect here between what the governor is saying and what the analysis shows?
Well, like I said, I believe that the governor and his administration have underestimated the total amount of enrollment, and we've looked at experiences in other states and looked at several different nationwide studies about Medicaid expansion to come up with these numbers. And, the governor, along with the hospitals, have cooked up sort of a tax scheme to where the hospitals and health insurers would provide some of the state costs. But what we believe is that the amount that the hospitals and the health insurers have agreed to is far less than the 10% state share that North Carolina would be responsible for. So this would leave us with a funding gap, or it would leave with the governor to go back to the hospitals and ask for another $100 to $200 million perhaps just in 1 year.
So if this tax on hospitals and providers can't cover the state's share, how would it be paid for?
Well, that's the question that we're posing to the governor now, because he says that it would require no state funds, but what we find is that there would need to be appropriations, and there would be this funding gap that would need to be made up somehow, and we believe that would need to come out of either new taxes, new state funding that's already slated to go somewhere else, or he would have to go back to the hospitals and ask for another $100 to $200 million perhaps.
Jordan, let's talk a bit about the program itself and who the current enrollees are and who it is that the governor wants to add. There's a huge number of North Carolinians that are currently served by Medicaid. Tell us about that.
Right. So we have a very large Medicaid program, upwards of over 2 million people, 20% of our state's population on Medicaid right now. And what we know is that if you expand Medicaid, this opens up the eligibility to adults that are not previously eligible for Medicaid.
Because right now, Medicaid is supposed to be about the most vulnerable populations in our country.
That's right. This is for poor mothers, poor children, the elderly, the blind, and the disabled. And, that's why we believe that we should not expand Medicaid, because we should leave this program intact for, like you said, the neediest in our society. And that's what the program has largely done until the Affordable Care Act came along. And, I think it's really just poor healthcare reform to just expand public funding, when there's all these other options out there where we can make a more functional healthcare system where we won't have to put up all this public funding and expand the role of government in healthcare, which I believe has led us to this dysfunctional system that we have today.
How many people does Governor Roy Cooper want to add to the program, and do they fit the profile of the most vulnerable?
Well, they certainly struggle to afford health insurance, but I think that's more of a knock on, our current system and the Affordable Care Act than anything else. But, as we go forward and we see that people, may need care, there are other options. And so, yeah.
So it's about, 500 to 600,000 people that the governor's talking about
Right,
here?
and that's one of the things we get into in the paper is that, the governor's not really clear on this, and he's making these estimates based on broad guesses, and that's why one of the reasons we believe he's underestimating the enrollment and the cost per enrollee in his final calculations.
And Jordan, one of the really important and fascinating pieces of data in your new report, which, by the way, available at johnlocke.org, is the profile of that 500,000 North Carolinians or so that the governor's talking about adding. Many of them, according to, I believe it's the Kaiser Family Foundation, are able-bodied, working-age adults, so clearly outside of the Medicaid profile.
Right. And, this is, if we looked at the history of entitlement programs in this country, this is exactly how it always happens. There's our legislators that believe a certain population of individuals deserve government benefits, and they work on behalf just to extend benefits to this new population that's deserving, in their opinion. And so, we need to leave these programs intact for their intended purpose, and, able-bodied adults who, may just struggle to afford the current products on the market that are set up by the Affordable Care Act. I don't think it's a reason to blow up our Medicaid program and invite all these additional enrollees that will be paid for by the government.
Jordan, in your report, you focus on a number of different scenarios based on enrollees and costs, et cetera, in order to do these economic calculations about what would happen if North Carolina did indeed expand Medicaid. But I know that you've also written a lot over the past months about your concern for the people who are currently enrolled in the Medicaid program. There's a phenomenon called crowd out that concerns you. Tell us about that.
Right. So, we have one of the most rural populations, and that means that we have a lot of what we call medical deserts or provider shortages in areas. And so, just giving someone a Medicaid card doesn't guarantee that they're going to have access to care. We know we have a limited supply, and there are, these people that are already on Medicaid right now accessing care. So, if we have a very, very limited supply and you overload the system with an increased demand, it could really have impacts on those that, are just normally accessing care, and it could overload providers. Not all providers accept Medicaid, so this could all play into, the access and supply that we see for the most vulnerable around the state.
So, Jordan, if not Medicaid, then in our remaining moments here, what is the future for people who are challenged and need affordable health insurance?
Well, what I've written about a lot is that North Carolina should apply for a state innovation waiver, and this allows us to waive certain federal regulations, restructure our healthcare subsidies, and lower insurance premiums for everyone across the board. This is it's been used in a lot of different states. It's been very successful, and it would help everybody.